And this really shows a happy person at the end of her rehabilitation. That's what we want people to do. You know, it probably took you a while to bend your knees so you could get down to a garden, but this is what we want. Good hand function, good lower extremity function, good cognitive function, good communication. So this is what we want.
Okay, great pictures. When you were talking about the oncology rehab program, and that's for cancer survivors.
That is.
What physical conditions does cancer treatment cause and surgery that require rehab?
Well, you know, that's one of the reasons our team went through the learning modules. There are specific problems with specific cancers. Right. All seem to have issues with fatigue, endurance. Some of the medications that you have to use to survive cancer can have some side effects that could cause some loss of sensation in areas, some specific side effects there. Most people think of breast cancer survivors when people used to have fairly large surgeries and dissection into the armpit. That would tend to obstruct flow in the lymphatics, and so people would get what's called lymphedema, or extensive swelling of their extremity. And one of our focus is reduce that amount of swelling. You know, prostate cancer, radical prostatectomies have their own issues of pelvic muscles. Chest folks, brain cancer can end up with some loss of neural function as well. So it's all geared toward getting that person back to the life they'd like to be living.
You know, I think people, when you say cancer surgery, they just think surgery, some chemo, and have no idea of the long-range problems that can result from some of the surgeries. So it's good to know that that is available here in this town.
Right.
You mentioned the inpatient rehab program. Is there anything else you'd like to say about that?
Well, it's a very structured program. You wear your regular clothes because we want to teach you how to put them on, take them off, get into a bathroom, get around, because we invite the caregivers to come down and participate, but not to take over for the patient who is learning these skills. There's a lot of coordination of care, as you mentioned, with social service, finding the right destination for this patient. Can they go home? Can they not? What are their needs at home? So it's a great, I think, a great program. We have a quality measure that's called a FIM score, Functional Independence Measure, and it's a way of rating our progress with patients. It really relates to how much effort it takes them to do a specific task. Does it take someone's help? Does it take two people to help? And we rank ourselves based on our improvement. So we have really done well in this improvement and shortening their length of stay to get to that goal. But each FIM score, there are 126 possible. Each one you get higher saves about 5 minutes in an activity of daily living. So if we improve someone's score approximately 20 FIM, then we've saved a caregiver's time or that patient's time, you know, up to an hour to help get them going in their life.
Anybody who's ever been to rehab services and watched the rehabilitator work with the patient, it really is an awesome thing to see.
It really is. You know, we have therapists that have sung to patients because they're so inhibited when they're thinking about what they're doing, and they're able to move better. You know, kind of a little kick under the foot. You're putting too much weight down. You know, we have great therapists.
We really do here in Lynchburg.
And I have been able to work with most of them, and the care they give and the quality of the care they give is great.
It really is. Now, you told me that Centra has partnered with Scott Insurance on a work program, return to work program called HealthWorks.
Right. It's called HealthWorks, and it has two facets. And the two facets are the acute work injury. And so we have Dr. Price and Dr. Johnson, who work in the emergency room, who run that aspect of Jerry's the medical director, Dr. Jerry Price. And we treat the patient's acute injury. We can treat a wide spectrum of injuries. We do drug screenings. We do kind of pre-work assessments. And then we get the patient back to work. And it's, again, the team of getting someone back to work and the sports medicine concept of getting someone back to work is very important. Now, occasionally, patients don't fit the schedule of return that is expected. Either they have injury problems or motivation issues or just difficulties recovering from their injury. So Andrea Stutzman in our Work Recovery Center is where you go for that. And that's more of an intense assessment, intense evaluation, a very specific program of recovery for that patient. I described it as boot camp, but it's not really boot camp in the sense of not carrying and putting you through all these paces. It's kind of a shepherded way to get you back to your job. And they have been very successful in getting folks back. I serve as an orthopedic consultant for the group and see some of the orthopedic injuries.
We have about a minute, a minute and a half.
It goes fast.
It goes very fast. I just want to hit briefly, I was going to do more on your clinic that you hold once a week in Danville, your orthopedic clinic.
Centra was approached by some physicians in the Danville area about specialty care. And a group, and we asked them which specialties is there a need, and one of them was orthopedics. Now there is a very good orthopedic group there, and there is a great one here. So we just went down there to test the water, so to speak, in urology, in orthopedics, in work recovery or occupational health, and neurosurgery, and cardiology. And we have been very successful starting a clinic in Dr. Settle's office. He runs an urgent care practice, and he rented us some space over by the airport. So we all enjoy going there, and it's worked out great.
I'm glad that you're doing that, and I'm very pleased to know all these things that you're doing with rehab here in this area. I thank you so much for being my guest. We could talk a lot longer because I think this is fascinating. Hope you all have enjoyed tonight's program. Next program will be a Cato fashion show. All three managers from the local Cato stores will be here, so you don't want to miss that. Thank you very much for watching. Have an excellent evening. Good night.